Good afternoon. I am Shakara Cook, and I am a family nurse practitioner. I'm going to do a few questions with you guys, and if you have any other questions afterwards, you feel free to just make a comment in the section, and I'll get back to y'all. So, first question that I was asked about was, what is the title? And according to the American Association of Nurse Practitioners, NPs are licensed clinicians focused on managing people's health conditions and preventing diseases. An FNP is an advanced practice registered nurse who provides a wide range of treatment based on different foci that you choose to go in, whether you do family or pediatrics, geriatrics, or any of that. How long have I been a nurse practitioner? I've been one for 3 years now. I graduated in 2016 and I took my boards in 2017, and I've been one since then. What is my favorite thing about this profession? I would say it's the autonomy that I have. I'm able to assess, diagnose, and treat the patients all within my scope of practice. And my least favorite thing about the profession is that I have to have a collaborating physician. In the state of Texas, which is where I live, I have to have an AKA permission slip to practice within my scope. I just have to have someone that will sign on saying that what I'm doing is okay. I mean, I'm still autonomous, but I have to have a collaborating physician, and I really don't agree with that, but I have no control of that yet. We're working on it, but as of now, we do have to have a collaborating physician. Said some advice for someone who wants to be in this industry. So I would say a great way to prepare yourself for NP school is to talk to current nurse practitioners and NP students or recent graduates. They can provide you with all kinds of information, and of course, if they're a new graduate or they're currently in school, they have the most up-to-date information that might help you. I used to hashtag NP students or family nurse practitioners on Instagram and reach out to them just by that hashtag or the school that I chose to go to. Like, I went to TWU, so I would just type in TWU students, and if the person was seemed to be welcoming, I would just slide in their DMs and ask questions, and if they were, very wanted to help me out, I would just inbox them and find out, build exchange numbers, and go from there. And I've made some great connections with people, and I try to do the same thing for other NP students or recent graduates who might have questions about anything. What was my first position in this profession? And my first position was of course, a nurse practitioner, but I worked at a laser away clinic, and it's like aesthetics. So I did Botox, cool sculpting that removes fat. I did hair removal, laser hair removal, and laser tattoo removal. It wasn't what I went to school for, I felt like, in my opinion, but of course, as a nurse practitioner, I had to do the face-to-face consultations for patients. But that was what I did when I first graduated. It was my first job, should I say. After that, I got a job working in a family practice clinic, and I learned a lot there. It was more of an integrative place, and integrative medicine just treats the patient holistically, not just, from a medicine point of view. He would do adjustments and things like that. I never did it, but it's definitely a great way to learn. Like, I learned a lot of things from that clinic, and I would totally recommend working in a family practice because you get to treat patients in a broad scope. I mean, I saw the whole entire family. I could see the baby who was just born, a few months old, or I could see the grandma who came in with them. So that was a great learning experience. And I currently work for Low T, and I treat men's health here. It used to be only testosterone replacement, but now we do everything. We manage their diabetes if they have it, hypertension, hypothyroidism, or just do physical assessments. I can do hyperlipidemia and all that. And this is a great way to treat different kind of populations, because we're getting the men who probably normally wouldn't even come into a clinic to be seen, but since they're getting what they want, their testosterone replacement, we get to treat other things as well. Wants to know what helped me get promoted or helped me climb the ladder of success. And I'm a faith-based person, so I would say God. He allowed me to get through school. He allowed me to pass my boards. He allowed me to find my job, and I have to give him all the credit because it's because of him that I'm able to do this. And I always believe that promotion comes from God. So also, I operate in a spirit of excellence. So I try to get to work punctually. I do my job to my best of my ability. I, treat the patients as if they were my own family members. I just take that into account. How would I want my mom, my grandma being treated? So I treat them with the utmost respect. nothing's out of my scope. Well, not of my scope, but nothing's out of my range. I'm not gonna say that's not my job. Like, you don't want to go into anything like that. So those things help you keep, being promoted, just operating like that, in my opinion. Some resources that anyone in this profession should take advantage of. I would say the AANP website is great. It's a great resource for nurses and nurse practitioners. It has a list of certification boards that you can choose from. It has different job openings that you can use. It has like discounts if you decide to join the AANP, which will help you figure out like where you want to work, what jobs are available to you in your area. It's just a great resource. You can connect with different people and nurse practitioners and students. It lets you know like what meetings are going to be held, where you can go and just connect and have a great connection with different people. So I would definitely recommend the AANP. I'm sure there's more, but that's what I did. What type of environment do I work in now? Well, like I told you, I work for Low T. It's a clinic, a specialty clinic for men, and I love it. I mean, it's different from what I'm used to, but it's great. Like, I treat different things. It's a specialty, but you learn so much from it. Like, I'm treating, like I told you, hypothyroidism, diabetes, hypertension, hyperlipidemia, just doing their assessments for the men, just, being a sounding board. Of course, low testosterone, we'll, treat all those conditions as well. So that's what I do now. The hours are pretty great. Like, I work day shift, of course. Some days it's 8:30 to 5:30. Some days I work 8 to 5. Some days it's 7 to 5:30. But those are great hours in my opinion. If I work weekends, I just do 8 to 12:30 p.m. and it's differential pay, so that's always a plus. Let's see. What educational requirements do I need for this profession? So most FNPs earn their bachelor's degree, I'm sure you know, in nursing, and then they take their NCLEX past that. And once you do that, you just get your master's degree, and once you get your master's degree, you'll take your boards for that, and once you pass your boards, you're able to work. That takes about 1 to 3 years of study, and once you do that, you pass your boards and move forward in your career. Any other certifications for this profession? So I took the AANP boards. You can also take the AANC. I chose the AANP for me. I mean, I passed it on first try. I studied the different recommendations they had for that AANP board, but you can do different ones depending on what your specialty is. And what position am I working towards next? I'm currently working on my doctorate. I'm going to school for that online. And I just want to earn my terminal degree. That is my goal. It's a personal goal. I won't say you need it, but it's always nice to have it. You can't ever get too much education, in my opinion. So these are my insights for it. I hope something I said was helpful for you. If you have any other questions, feel free to, like I say, DM me or just write it in the comment section. And yeah, make sure you like and subscribe to Corporate Minority for more information like this. Y'all have a blessed day.